Welcome back to another episode of Biohack-it, and salam alaikum.
Wa alaikum salam.
Today, I think I have my new New York bestie. We're going to be best friends. That's just
100%.
That's what's going to happen.
We like a lot of things common.
So, Dr. Zaher Merhi, you are a renowned reproductive endocrinologist and the founder of Rejuvenating Fertility Center, RFC,
Yes.
which was established in 2020. And for those of you who don't know, I am going to be doing PRP and stem cells for my ovaries with Dr. Merhi. I fell in love with him. I got introduced to him by another incredible fertility doctor, Dr. Amy, who I adore.
Love her.
Yeah, and I was going to go to San Francisco to do the PRP, and she said, no, I have the best guy on the East Coast. And I said to Dr. Amy, only if he's as good as you. And she said, don't even worry about it. And that's where our friendship started.
She's so sweet.
So thank you for coming on to Biohack-it.
Thank you so much for having me. But just to be clear, I'm co-founder. I have a team who founded RFC
Amazing,
with me.
okay.
Dr. Marco, so I have to give them credit. Marjorie Butel, who's our CFO, and Jessica Harun, who is one of our nurses. So they also partner.
There's a whole team.
They are partner
Amazing.
RFC. You cannot do it alone. You have to have a good team.
And that's a beautiful thing. I really love that you explained that because
Thank you.
I think sometimes people don't give enough credit to the people who help them build their companies. So thank you for, bringing them all in.
And Dr. Amy, we love you.
Dr. Amy, just adore that woman. I just absolutely love
she's
her.
amazing.
So I wanted to start with, it's so interesting everything you're doing with PRP and stem cells. Let's start with the PRP portion. Two things. One, I saw a lot of research come out of Greece. You were the second person in the U.S. who started doing PRP for the ovaries.
Correct. As far as I know, I think Dr. Sales in California was the first one in the U.S. And I was really watching the data from Greece, and there was a lot of compelling evidence that it works. So, yeah.
And everyone's going to be like, why do PRP for the ovaries? So can we explain what is PRP? How does it work for the ovaries? And who is a candidate?
So PRP is platelet-rich plasma. It's basically the patient's blood. It's a layer from the patient's blood, right? We take blood, we spin it, get that layer, and then this PRP did not start for the ovary. Actually, it's used for face, for joints, athletes.
Even hair.
Even hair. I'm planning to do it on my hair. I'm getting bald here. I'm serious. So it's done for athletes. Athletes, they do it after injury because it makes them heal faster. What else? Dentists, they use it a lot now. Now, the Greek people are very, very smart, so we have to give them credit. And Dr. Pentos is the first doctor who did that. So we have to give him kudos to this. Now, it's been done for the ovaries. Now, PRP, the way I describe it is like candy for a baby. Imagine the eggs are babies and you're giving them candy. They're going to be super excited and happy, and they're going to function better. But not only that, it also can wake up some of the dormant eggs that women have, right? Women, even postmenopausal women, and Dr. Pentos from Greece, his team, published many years ago, postmenopausal women getting pregnant after PRP naturally, up to age 46, I believe the oldest person they published. Now, the way I describe it, Iman, is imagine the eggs are seeds in the ground. You don't see them, right? What you see on ultrasound is, imagine this seed becomes a bud and a flower. That's what you see on ultrasound. If there's no flower, it doesn't mean there's no seed. Now, the PRP is like you're putting food in the ground for those seeds to kind of wake up and grow. That's how I describe it. Now, there's more molecular mechanism I'm happy to discuss. We have published that it can improve egg quality. We've published that it helps women get more genetically normal embryos. Happy to go through the mechanism. But this is what PRP is in summary.
And on average, what is the age of a woman who's coming to you for this procedure, and what are her levels look like? Like, who is a candidate based on their levels?
I don't care about the levels anymore. Okay. As long as someone is healthy to carry a pregnancy.
Okay.
And I don't give a excuse my language, I don't give a shit how old she is. If she's healthy to carry a baby, she's a candidate.
Amazing.
We've helped women up to age, with FSH, people are focused on the number. They don't mean anything. They do mean, but they tell you quantity, they don't tell you quality.
Okay.
And all it takes is one good egg to make a baby. And we've helped women with FSH over 100 have babies with their own eggs.
Yeah, that is what I love. So just so everybody, here knows, I have I'm surprised because I'm so freaking healthy, but I've had mitochondrial dysregulation and toxins anyways. I have very, very, very low AMH. I think my number is 0.088. And I forgot what my FSH was, but it was pretty high. And so that is why I contacted you, because I got worried. And Dr. Amy said to me, listen, before you do a round of IVF, do the pre-work and get your body so prepped so when you get the cycle, when you get the drugs, it just is perfect, in some extent.
Look, Iman, even if your AMH is 0, you still have eggs, but they're not producing AMH.
Yeah.
They are dormant. That's why postmenopausal women have 1,000 eggs. And we know from 70 years ago, they did hysterectomy on those women who are in menopause. And they took the ovaries, cut them, and look under the microscope, and they found 1,000 eggs in total.
Really?
We know that. Now, those that don't produce AMH. So people think AMH is 0 means there was no more eggs. That's not true. That's what PRP does. It wakes up those dormant eggs in order for women to have healthy babies.
How many cycles of PRP are you, does somebody need to do multiple, one? Because you talked about there's a skill set that you use, because not everybody does this. Some people actually end up scarring. That's why, guys, if you're listening, please be really careful. A lot of people can leave. They don't know how to do this and they're novices to this. They can leave scar tissue on your ovaries, and that's a shit show. So really why I love Dr. Merhi was because he's been doing this for a long, long time.
Well, it is. Look, PRP, first of all, it's like a secret sauce, right? Nobody wants to reveal the secret sauce, but I'm going to tell you what I do.
Tell us all.
Now,
tell me everything.
First, it depends on how you prepare it and how much you take. 2, it depends what size needle you put.
Okay.
If you use big needle and the ovary is this tiny, most of it's going to leak out.
Right.
You need to use a very, very thin needle. I use a very tiny needle. 2, you need to know where to put it. Outside, not inside. The ovary is like Earth, and the eggs are like people on Earth. We are on the surface. If I have a needle coming from the sky, PRP, to feed us right now, and they go and inject in the ground, you and I can't eat.
Right.
So you have to put it on the periphery of the ovary multiple times to distribute as much as possible, right? So finally, the amount. You need to give the right amount. Your ovary size is different than someone else.
Correct.
Your ovaries have different size.
Right. And you do that when you go in.
I haven't seen them, but I'm just guessing. But most people don't have similar. But you know what I mean? You can't put it. So some people say, "Oh, the PRP didn't work. It's bullshit." Well, it's not. If we just want to know how it's done.
Technique,
needle, how many times, all those things.
And then do you do it? One is there's sedation, right? There's local and general.
Yeah, you could look. It's anything, even egg retrievals. I do most of my egg retrievals. Patients are awake.
What?
If the ovaries.
What sort of superwomen are you seeing?
But that's why I don't have BMI cutoff. You can be, some people deny them because they don't want to put them under IV sedation to sleep because there is apnea and breathing issues. I do it under local anesthesia. What you do is the ovaries, if they are normal and someone didn't have big fibroids or previous surgeries, they are sitting there close to the vagina. And the vaginal wall is here. You don't go through the uterus or the tube. You put local anesthesia on the vaginal wall, wait a few seconds, like going to a dentist. Then you go in and poke the ovaries. The ovaries don't have pain nerves. They have pressure nerve. So patient will be pressure, but no. The vaginal area is what's sensitive, and you just numb it with lidocaine.
Amazing.
Or if someone is sensitive, you put them to sleep. If someone's ovaries are deep, and sometimes I do it abdominally. Right? Yeah.
Wow.
So it's like amniocentesis. So because people have C-section, big fibroid, the ovaries are deep. You don't want to put it under local anesthesia. It's going to be very hard. So you put them to sleep. So we individualize, but some people are sensitive too.
Yeah.
Some people have vaginismus. You can't put speculum inside, and that's, so you have to put them to sleep. So it depends.
And how many rounds of PRP does somebody need? Is there normally one round of PRP? You're good? Because you said to me it lasts about 2 months or 3 months?
3 months. Okay. Look, Iman, I am an evidence-based guy. You need to show me studies to convince me. Something, right? I'm not aware of any study comparing one PRP to 2 or 3 PRPs. Until then, all I can tell you, I tell my patients once, I can't just take people's money and say, do one after the other. It does not work like that.
Yeah.
In my practice, and we've been doing PRP for 8 years now, it's good for 3 months or so. Now, sometimes one doesn't work, and I've seen patients get pregnant naturally after the second, even the third PRP, but I space them out every 3 months. The question is there an additive effect? Do I need to do more than once for it to work? I don't know the answer, but some people
Super new
need
research,
it.
yeah.
It's like the face or the hair. You do multiple sessions. For the face, I don't think
Absolutely.
you...
And I wanted to start getting into a little bit of like, why are we seeing, and we talked about this the other day, why are we seeing so much more infertility? I mean...
Well, it's crazy.
In men and in women.
Oh, yeah. That's what pisses me off, right? I mean, I don't like to talk politics, but the government should pay more attention on infertility and fertility. I really think it's a pandemic that no one talks about. We're seeing more than double increase in infertility. 1 in 5 women now have infertility. We used to have 1 in 5 couple. No, we used to have 1 in 12 couple. So that's more than double.
Yeah.
So, and I don't see any politician, I don't talk about it, but I don't see anybody talking about it. Look, Iman, we live in an environment that's inflammatory and toxic. A lot of toxins. There are studies on tampon that we spoke. Tampon have chemicals that kills. Imagine what they're doing for the ovaries. Yeah. Condoms, so many things. Cell phone, you put in the pocket, close to the testicles. If you go and go on PubMed and see studies, how many studies on cell phone radiation is bad for sperm.
Yeah.
Nobody talks about it.
Microplastics.
Hand sanitizers. Go read about it. Plastic. The air. So many things that I really think... there is numbers. Numbers don't lie.
Yeah.
More and more people are having infertility. Some countries have 400% drop in sperm concentration.
Shut up.
I'm not kidding you. Google it. 400% less.
Where?
Correct. I don't remember the country, but a lot of countries, not just one. A lot. Yeah. So, menopause. Women are going... we have 3 times increase in premature ovarian failure. Used to be called, I don't like this term, I like to use premature ovarian insufficiency, which is menopause before the age of 40. It used to be 1% of American. Now, 3%. Nobody's talking about it. It drives me insane.
And this is why I'm so passionate about, if you follow me on social media, I'm so passionate about this whole movement with Make America Healthy Again and all this stuff. For me, it's not political. It's about who is actually talking about the problem, like, as important as IVF is, as important as women's reproductive rights and choice are, and by the way, completely pro-choice in a woman's health, I'm at the same time stand with the camp of like, why is there so much infertility? Why are so many of us, including myself, right? I'm going through this journey. And I did this really specialized test from Germany called IGL, and they check for every single environmental toxin, heavy metal, microplastic. I came back so high in things like formaldehyde, nickel, microplastics were through the roof. And this is me who eats organic, has non-toxic cleaning products. I'm like, if this is me, somebody who spends so much time of my life trying to biohack all of this stuff, what does the average person look like?
Very bad. Look, there is study, brain there is 40 times more, 40% increase in plastic in people's brain.
Correct.
Imagine what's happening to our testicles and ovaries.
That's what I'm saying.
It's a big problem. Let me tell you, I think in a decade or so, people that get pregnant naturally by sex, they're going to celebrate. It's going to be like, open champagne.
Yeah. Hold on, bring it on.
It's very, very hard.
Yeah.
To have babies these days is getting very hard.
It's just, and I was just shocked at, I would have never thought, and for me, what shocked me the most was I'm so healthy, I don't drink, I sleep well, like I eat clean. My level was like, they tried to explain this to me. They were like, oh, your FSH is close to being like closer to menopause. My mouth was on the floor. I'm like, look at me. Do I look like I'm going into menopause? What
you look like 25 years old. I swear to God.
I was like, but the insides are not feeling that way.
We'll work on this. Don't worry. We'll work on this.
I want to be like a 21-year-old.
But listen, my goal in life is this. I don't give a shit about how much money in the bank account. Sorry, I don't mean.
Yeah.
We want to change the world. We want to move. We want to push the field forward because I'm tired of the status quo in IVF. I'm being honest with you.
Please.
I'm really tired, and so many studies is showing that we could do it, but everybody, if you're doing something, you need to be called crazy. I was called crazy when I was started PRP 8 years ago.
Yeah.
Now 90% of clinics in Manhattan, they offer PRP, which makes me happy. But look, I really think there is a lot of things we could do to humanity and human race to move the field forward. And people like you and even older who are very successful, they should have baby with their own eggs. Yeah. And we will do it. And my goal is to have 60-year-old pregnant with their own eggs.
MashaAllah.
Call me crazy.
Yeah, but I think it's going to be like, no, but why not? I think you told me, I asked you this, right, when we were speaking. You have gone, your oldest patient that's gone pregnant with her own egg has been 51 or 50?
50 years old and 5 months, to be exact. We have couple in early 50s.
From her old and she carried it.
And she carried the baby and healthy. And they were very healthy. Healthier than me. Just make up a lot of issues. But, yeah, but look. Why men can have babies until they die and women can't? I understand this is a human biology, but I feel like it's not fair. If I am 60-year-old woman, I want to have a baby with my own eggs, I can have you carry my baby because you're younger and healthier.
Yeah, correct.
I have a surrogate. But I still have the option to have biologically related babies. Call me crazy, but I think people should have the choice to decide
absolutely
if they want to have baby or not.
And then I was going to ask you, can we get into a little bit about the other thing that I'm so excited about, the research that you shared with me, is stem cells for the ovaries. So we've done the PRP for the ovaries, you know, it's done under sedation, 2 to 3 months, you know, that's the kind of research out on there, and it's amazing. Now, walk us through what is stem cells for the ovaries, who's a candidate, how does it work?
So stem cells are used for regenerative therapies, right? Now, if there is a report in ABC on ABC News, April 1st, Fool's Day. I remember that because it was Fool's Day and day of my first marriage. I got married on April Fool's. Do not get married on April Fool's Day because it will not end up doing good for you. But
life is going to pull you into a fool.
But it's on ABC News and it says paralyzed men now are able to walk after stem cell therapy. The spinal cord, we know, if I cut my spinal cord in a car accident, right, it's cut. I can't walk anymore because there is no electricity between. If you put stem cells, it can become new neurons and fuse it together, and now they're able to walk. Stem cells are unique because they can become any cells we want based on where we put them.
Right. Okay.
If I take stem cells from your fat belly, you have nothing. Can you eat, please, before we go?
I just got diagnosed with a massive fibroid. 3.5 inches.
But you have no fat, so eat. But fat have a lot of stem cells. That's why I'm talking about fat. A lot. It's very abundant. Bone marrow. Wow. We're not going to do bone marrow.
That's painful, I've heard. Yeah.
But mini liposuction can be done even when you're awake. But fat has a lot of stem cells. If I take stem cells from your fat and put it in your liver right now, give them a few weeks, they become liver cells. But they're younger than the cells you were born with.
How come?
Because now they're being... Okay, how come? Great question. The cells activate those stem cells to become like them. The tissue has identity. Anybody who gets in becomes like them as far as stem cells. Mm-hmm. If I take stem cells from your fat or bone marrow and put it in your kidney, they become kidney cells because the other kidney cells activate these cells to become like them. Now you put them in the ovary, they have the potential to get activated to become new eggs. So now they're younger than the eggs you were born with. Mm-hmm. Now some scientists disagree on this theory, but they definitely, some have shown in some study that they can become new younger eggs. Now, they work through other mechanisms. They increase blood flow to the ovaries. They increase immune modulation, meaning it's like you're bringing life to these ovaries to act younger. Now, if you put stem cells in your IV, if I inject IV stem cells, they go all over my body. If they sit in my brain, guess what? They're using it to treat Parkinson's now. IV stem cells. So now the question is, which stem cells is the best? We don't know. There's multiple types of stem cells. Your fat, bone marrow, you have placenta, and you have umbilical cord.
Right. But placenta and umbilical cord I can't get because I don't. Right.
Well, you can get them from other people.
Ah, okay.
They're sold by companies. There are companies, FDA approved now. They're putting them, they're Erivan, for example, ERIVAN. They have their first studies in humans and showing safety in humans.
But isn't that taking in someone else's biological?
Great question. That's why now we're doing exosome. Exosome, you sent it to me.
Yeah.
That's the future. The exosomes, they don't have stem cells. Exosomes? They're bubbles released by stem cells. That's what the most important part of the stem cells. Mm-hmm. And they are prepared right now by companies like Erivan, FDA approved. You could use them. And some experts think they are better than stem cells.
Yeah, a lot of people say that.
So that's what we'll do as well.
And you do that for the ovaries, essentially.
Correct. We do that in the Bahamas. You're coming to the Bahamas.
I am.
Yes,
October
baby.
23rd. So I wanted to also ask, how many rounds normally does somebody need for stem cells? One and done. Khalas, finished.
Honestly, I don't know.
Okay, it's case by case.
Again, I'm a very evidence-based guy. We're collecting data now prospectively. We started last few weeks ago. We had the opening ceremony. We're collecting the data prospectively.
Perfect.
So maybe in a year or two, I can tell you better.
And the people that you've seen, do you know of other clinics who've done this in places that have done?
Yeah, I mean, I think there are places in Mexico,
Yes.
Other places in Europe. I'm
Greece,
not sure,
I think,
Serbia or Greece.
Greece
Yep.
has done
so
it.
they do. So I'm not aware of studies they've published yet either. So, but we're doing it I'm doing it actually in conjunction with Dr. Ayman Al-Hindi, who's a professor at University of Chicago.
Amazing.
We're both collaborating in the Bahamas project so we're doing it very, very well done. Yeah.
I'm really excited about that. And then you said to me, basically, with the stem cells, traditional stem cell therapy, they've had also really high, outcomes when it comes to older pregnancy, correct?
Yeah. There is plenty of studies in animal model and in vitro showing that those stem cells reverse menopause.
Amazing.
Up to a certain amount. Nothing lasts forever. My first marriage lasted 6 years. So nothing lasts forever.
Second one, we're going to make sure it's winner, chicken dinner.
But you know what I mean? Nothing lasts forever. I think they last for up to 8 months based on what I'm seeing so far. But they have, at least they have the potential to help us and give us, a good path to
forward.
Go. Right, forward.
But don't you think if you help somebody's ovaries become younger, then you're slowing down the whole aging of the ovaries process and you're slowing down the whole menopause process? Shouldn't it take longer than to go into menopause overall?
Well, look, the whole purpose is to reverse menopause. Now, women, you lose most of your eggs at birth.
Yeah.
The highest number of women's eggs when you were in your mom's belly and your mom was 20 weeks pregnant in you, which is 5 months or so.
Yeah.
That's the peak number of eggs you've ever had. After that, you start to lose. So technically, if we can do something in utero, which I'm not saying it's anytime close, to slow down the death of those eggs, you can have menopause at 100. Two,
from your mouth to God's
if you
ears.
do something at birth, same thing. By the time you reach puberty, you lost the majority of their eggs. So they really only have 400 cycles or I don't know, something like that. It's not a lot. But remember that another thing, Iman, and people need to know is that when you ovulate 1 egg per month, you're losing up to 20 eggs every month. Exactly.
What?
Yes. When you do ultrasound, let's say how many follicle you have on ultrasound?
So I have a lost scar too. So we'll go to I think my left ovary has 6 to 7 follicles, and my right ovary is like the size of a blueberry because my ovary was reconstructed. It's a baby ovary. I don't know if there's any follicles on that one because it's so little.
Let's say you have 6 and 4.
Yeah.
Let's say you have 10 follicles today on ultrasound. Today is day 1 of your cycle. Mm-hmm. And let's say you ovulate on day 14 and your next period will be in day 28. Out of those 10 follicles, they start to fight. Only one wins the fight, starts to grow, the follicle grow, and you see it on ultrasound. It bursts at day 14, you ovulate, and then by day 28, the other 9 also dies with it.
So why do they scan women then to check how many follicles they have on their ovaries? Because each month you can have different follicles, no?
Right. So you have eggs that you don't see on ultrasound. And the follicles are you're spending this month. If I'm doing IVF on you right now, and this month you have 10 follicles, I'm giving you medication to feed the other 9. So the maximum you're going to get is 10 eggs.
Right.
So that's another important thing, is that when I do IVF for somebody, I'm not taking away from your bank. I'm just taking away the eggs that were going to die anyway that particular month. And that's what drives me crazy when you see patients with one follicle and they're being pumped with shots.
But they're not
They
ready.
develop one follicle anyway. Leave it alone naturally. You're not going to get more eggs.
Yeah.
So it's the ovaries are inefficient, unfortunately. So when you ovulate one egg, you're losing a lot. And slowing those follicles, and scientists tried. Birth control pill, they do not. The follicles still die. So slowing this down will develop menopause, and menopause comes a lot of issues. Yeah. Osteoporosis and heart disease and GI and colon cancer and Alzheimer's.
Saggy skin.
It's not just for having babies. And I have a lot of people who do PRP and stem cells. They don't have babies, but they just want to have better health. Ovarian health, if you want to
Absolutely. And that's the big thing as well, right? It's the whole thing, like most of us, well, a lot of people now are having kids even later. We're going to be parents later, so we want our energy, so we don't want to go into menopause. I thought to myself the other day, I'm like, there'd be nothing worse than be fully in menopause and have like a raging teenager. I don't know how to pull out my hair at that stage. I'm like, oh my God, funny. I will be that person. Mary better be like injecting me with stem cells and PRP, because I would have to deal with batshit crazy teenager in menopause.
Funny.
But it's true.
I agree with you. But listen, even if you're not in menopause, they're going to drive you crazy. They go through a lot of hormones. Then when they become teenagers, they hate you and they say you're the worst mom in the world. It's crazy. And then you give them cell phone and they become on social media. It's a shit show these days.
I always joke, we're Middle Eastern, you're not Pakistani, you're actually Lebanese. I laugh. I was like, we have very strict parenting styles. I'll be like, you can pack your shit and get right out and call me when you're done. I'm not this be gentle parenting when they're young, and when they get to a certain age, there's roles and responsibilities. There's basic respect. I'm sorry.
100%.
Like, I'm not, changing
100%.
My narrative for you.
100%.
I want to ask you these treatments, and why the Bahamas? Is it like people are going to listen and be like, oh, she's going to the Bahamas for these treatments? Why did you decide to open the clinic in Bahamas?
So I looked into multiple islands. I liked Aruba a lot, to be honest with you. Loved it, but it's far. Look, Bahamas is easy to get to. Bahamas is very close. It took me, coming back from the Bahamas a few weeks ago, it took me 2 hours and 20 minutes.
That's nothing.
To get to Newark. Oh, wait, but it took me 3 hours from Newark to my house. So it was fastest to fly from, I'm not kidding. I swear to God. It was longer to get home than flying from the Bahamas. It's very close. 1. 2, the Bahamas, they're very open to stem cell. And they are,
like Mexico.
They have a lot of stem cell frame. 3, I met Doctors Hospital, which is very reputable in the Bahamas, and they have affiliation with Cleveland clinics. 4, you can't just go in and do things on your own just because you can't do it in the U.S. No, there is an ethics committee that has to approve what I'm doing and the research. It took me 3 years, Iman, to get this done. 3 years.
Wow.
I love Bahamian people, but they like to be on vacation a lot.
Oh, yeah. It's like people like our part of the world,
And I'm hyper, so it was not great.
Like, damn
it! So the Bahamas, again, and here the FDA and other, again, I don't like to talk politics, but they need to pay more attention to things. Why mitochondrial replacement therapy, or MRT, is being approved in the UK 10 years ago or more, and it's not even approved in the United States. We're very behind. Australia, they do it. Ukraine, they do it. Why not? You can't even talk to them about it because they don't even have a committee to approve it or disapprove it. It's a joke.
I want to get into that. I'm going to talk about the mitochondrial replacement therapy, but before we go into that, what is the downtime or discomfort with stem cells for the ovaries versus PRP for the ovaries?
I think they both are really the same.
Okay.
You're putting the same amount in the ovaries. You could, I can tell you everybody is different. 90% of patients
feel nothing.
Do the procedures, they go lunch and shopping. right? 10% they might have discomfort because they're just sensitive. We're human. I'm super sensitive to things. Yeah. Trust me. If you're touching my tooth, I'll be in bed for like a week.
When's your birthday?
August 19th.
Oh, you're a Leo.
76. Yeah, of course.
I can see it.
Yeah, it depends. But most people really, it's you just wake up and if you slept and walk, yeah.
That's basically it. Yeah. And you don't feel any pressure or anything like that.
You might look again. Everyone is different. Most people feel like the little cramp. That's it. That's it. Some people describe it as spirit cramp. Some people is like, can you put me back to sleep? Or beautiful sleep. It's the best sleep ever. But most people really, I would say, mild cramp. That's it.
And then I was going to tell you in terms of like how long after when you do the stem cells for the ovaries should you wait to do an IVF cycle?
I would wait around 4 weeks or so for things to kind of kick
marinate.
In. Correct.
Is maybe 2 months better?
I don't know the answer. I can tell you a lot of people that I'm doing adipose from their own belly fat cell, I'm seeing a peak at 3 months. I've had a lot of people, believe it or not, in their 40s, menopausal between 44 and 47, pregnant naturally after the adipose stem cell PRP. Yep, adipose PRP. Was around 3 months, which shocks me. One of them miscarried, unfortunately, but 3 months seems to be the sweet spot.
So if I do it in October,
I've seen people responding earlier. So everyone is different. That's why I do it, and I say, okay, let's see every 2 weeks what's going on, and we'll take it from there.
Is there any supplements or things you advise people not to be taking while they're doing this?
Now, most places say don't take non-steroidal like ibuprofen and all this a week before and 2 weeks after. I don't really reinforce it just because the data is really very weak on this. But yeah, those are the things I'll probably stay away from, steroid and stuff like that.
And supplement-wise, everything is
Supplement-wise, so I love supplements. We did Rejuva supplements. I work with Amy Raup and Dr. Mark Sklar. It took us also another 3 years to build a supplement called Rejuva, which I'm very proud of because it's the first to put all these supplements that are good for egg quality in one pill.
Amazing.
For example, CoQ10, vitamin D, NAC. I used to have patients take 20 boxes.
Yeah, that's what I've been doing.
And we worked with the chemist from California. It was a lot of work, but I'm very proud of this product. I really am.
And is it because the dosage is really high of each product, or is it just everything's in it?
Everything is in it. We have one for sperm. We have one for egg and one for mitochondrial function and oxidative stress. Yeah.
Where are my supplements?
I'll get you samples.
Haram, you can't without my supplements? I love supplements.
Me too. If you see my bathroom, you'll see all my shelf. You'll be scared.
Freaking hell. And what about, I don't know if there's any peptides you can't take when you're doing this. You know how like there's NAD and BPC? I don't know if there's any correlation.
Honestly, I'm not going to tell you something I don't know.
Yeah.
I'm not aware of anything like this in the literature.
Okay.
It doesn't mean in the future.
Because they help recover your body faster, so I'm wondering if you take it when you do this treatment.
I do not know the answer. Sorry.
And then I want to go into mitochondrial replacement therapy. So, because that was the one that I really didn't have that much of an understanding of. So, what is it? Who is a candidate, and why do you do it?
Great. First, let's start by telling you and everybody who's watching that the DNA of the egg is the same at any age.
Oh, so that's
if you're 18 or 60. Listen, when your skin with aging, when your skin wrinkles. Shut up. You're fine. But with aging, if I do biopsy from an older skin, the DNA is still 46 chromosome. Does it change? No. Same thing with the egg. The only difference when the ovary wrinkles, let's use that word. I don't like it, but let's say they use it. And I take an egg, the egg is still 46 chromosome. But around it, when your skin, the collagen and all that, right? Same thing. In the ovaries, the egg, the DNA is fine, but when it matures, the mitochondria has to split. Let's talk about egg, because I love food. I'm Lebanese,
we're
going
to be best friends. That's it.
We're going to go to Eliri for sure. It's my favorite Lebanese restaurant here. So the egg of a woman, imagine it is like the egg that we eat. You have a yolk and you have a white. Fair? Now you have an egg. The DNA is 46 chromosome. Now the yolk, same thing. The sperm, the father's sperm also have, DNA 46 chromosome, right? The DNA of the sperm has to split to 23-23. The egg has to split to 23-23. Then 23 from your mom, 23 from your dad. You become 46 chromosome. Fair? Mm-hmm. Now you're going to make children. So your eggs has to split with the sperm, right?
Yeah.
Now 46 chromosome. The yolk is 46 chromosome. The white, where the mitochondria is, has to cut the yolk into two halves, 23-23. What happens as women get older, the white is not sharp enough to cut it equally. It cuts unequally, 22-24. Those are bad eggs.
Yeah.
Okay, because 24 plus 23 sperm becomes 47. That's Down syndrome or other things.
Yeah.
Or a miscarriage. So the division, the white is what's getting older. Any questions so far? Good?
No,
now,
got it.
the PRP, it gives energy for this mitochondria for the white. You're sharpening the knife, which is a white. It's more likely to cut the DNA equally.
Right.
Vitamins and all this, it doesn't work on the DNA. It works on the white, which is mitochondria. Now, vitamins, PRP, sharpen it. But now what's the best thing? Get an egg from a donor, younger. Take the yolk of that donor, throw it out, and take your yolk and put it in the white. You have a younger knife now.
So you get...
And then mature it. Then mature it in the lab. It's more likely to cut equally to 23-23. And that phenomena can help women even in their 60s have babies. Listen, the DNA doesn't change. The Japanese did egg from the skin of a mouse. What's the difference between your DNA and the skin and the ovaries? It's the same DNA from your mom and dad.
Right.
The only difference is the skin doesn't cut DNA and the egg cut DNA. But if I take skin from you and make it divide in the lab, it's perfect. In the future, you're going to give me hair follicle and I'm going to make an egg from your hair follicle. I think that's the future. I think that's going to be the future one day. I'm telling you the truth.
I'm nice hair. You can keep some aside.
But these are the things, and I really think donor egg will be history soon. I really do. With what we're doing in the Bahamas, and if we push the field forward, you just need the mitochondria. And now you're passing your DNA to your children.
And when you are looking at certain patients, and they, like my case, I'm going to do the PRP and the stem cells and stuff, because we inherit our actual mitochondria from our mother, right?
That's right.
And so I didn't inherit. I blessed my mom. She was beautiful. She was amazing. So many things. Mitochondrial health kind of sucked. So I've got shitty mitochondrial health from her. I got
shitty teeth.
Yeah.
Trust me. I'd rather have shitty mitochondria than shitty teeth. But anyway, back to you.
So I think to myself, how do I improve? Yes, removing toxins from your body helps with mitochondrial health. NAD helps with mitochondrial health. What else can actually help your actual mitochondrial health? What kind of things? How can I improve my mitochondrial health?
Honestly, man, unless you want to go to Mars with Elon Musk, you need to be in an environment that doesn't have all the stuff that's hurting our mitochondria.
Correct.
So let's start there. Avoiding a lot of chemicals. Like you said, there is so many shampoos and soap and you name it, makeup, that's not good for mitochondria. Yeah. Mm-hmm. That's the reason why we're having more infertility. That's why more people are having less eggs and less sperm. So let's start there. If you are going to take supplements to improve mitochondria, but you live in an environment where it's killing it, the environment is stronger than us. I'm being honest with you. So it's going to be very hard. But there are supplements. CoQ10 is well known, very important for mitochondrial function, NAD and vitamin D, NMN. There's so many of them.
Yeah.
But the question is, which ones work for Iman?
Yeah.
I don't know. I think the future will be because there's so many supplements. We take DNA from your blood or run the DNA, and then based on the results, we'll tell you, okay, well, you more likely will get benefit from vitamin D or CoQ10 or this or that. Because some supplements don't work for people.
Right.
There are studies showing for the heart disease, most supplements don't actually improve, which is crazy. I respectfully disagree, but I really think it helps certain patient population. Yeah. but we do not know who. We're not the same. Everyone is different.
Yeah, 100%. I was going to ask you, do you know, I don't know if you know about this, but a lot of sometimes functional doctors and all prescribe DHEA. And then I heard contradicting evidence that DHEA is actually terrible if you're going through fertility. I don't know if that's...
The DHEA is tricky. And let me tell you why. Because it's a precursor for testosterone. You need some testosterone, but when it becomes too much, it becomes bad for your eggs. Now, most studies looked at DHEA at 75 milligrams and showed some benefits. But I can tell you, I've seen 3 groups of women with DHEA. Women who do well on DHEA. Women who nothing on DHEA. And women who do worse on DHEA.
Right.
Now, if someone has very low ovarian reserve, DHEA most likely will help them. The question is how much. I tell my patient to take 25 milligrams because with the 75 milligrams, they start to also have some side effect, oily skin and whatever, and acne and stuff. And I just want to be on the safe side and not give them something to become worse. Because again, testosterone could be bad for some people.
Right. So 25 milligrams of DHEA is okay.
I think so. That's what I do.
Yeah.
That's what I do.
And you've seen like the results have kind of been okay.
You know, the answer is it's multifactorial. It's not just the DHEA that plays an important factor. There's so many things. If I'm doing PRP on Iman and then giving you a wrong IVF protocol, you're not going to have good outcome whether you took DHEA 100 milligram or a 20 milligram.
Yeah.
So people ask, for example, it's so many factors. For success. When people ask success, talking about what? If you're talking about pregnancy, well, the uterus plays an important role. There's an implantation issue. Embryo, sperm plays an important role. There is more and more awareness on sperm DNA fragmentation. And actually, the American Society for Reproductive Medicine, if 2 IVF cycles failed, go to the man. So we always blame the woman, which drives me insane. Sperm can be perfect on sperm analysis, but the DNA could be fragmented, and that sperm is shitty, and it's not going to give you a baby, or you have to choose the best one.
Shouldn't you be testing men? Like my husband did all his tests. When I did all my tests, I said, I'm sorry if I'm going through this, you're going through it with me. So I made him
We can give him shots in his testicles if you want.
Really?
Just to torture him.
Hey,
why? You take all the shots and not even fuck him. I'm so
sorry, let's go.
Sorry.
That'd be a good one. But I was wondering, do you think, so why do a lot of fertility clinics not do DNA fragmentation testing right at the beginning?
Look, there is indications for things, right? As doctors, we don't want to jump and test everything from the beginning. Now, some patients ask for it, and it's okay to ask. If you come to me from another clinic and you had failed IVF, I am testing sperm DNA fragmentation.
Right away.
Yeah. And I am using this kit called Zymot to choose the best sperm with the DNA fragmentation.
Is that like ICSI or PIXI or?
No, it's actually a little kit that you incubate the sperm for half an hour, and the one that makes it till the end have the best sperm or the lowest fragmentation. The DNA of the sperm, Iman, is like the hair braid.
Yeah.
When you do it today, it's tight, right?
And then
with aging, what happens? It becomes loose. Mm-hmm. When it becomes loose, that's DNA fragmented. That's less likely to give you a good embryo.
Right.
More likely to cause miscarriage, even if the embryo is genetically normal.
Right.
So there is the sperm health is super important, and that's why what I tell you when people ask me what's the success, it depends so many things. You could have the best eggs, but if your husband have bad sperm, it gets harder. You can have best sperm and best egg, but you just have implantation issue. It's not gonna work. So I think we need to focus on what we mean by success rate.
And it's individualized. And then can we talk a little bit also about ICSI and PIXI? Like, what is the difference? Because I've heard both of them. And
so there is so many things. The question, Iman, is how do we choose the best sperm? Now, most conventionally, if I am an embryologist, your husband comes, gives me a cup and a sperm, I pour it, I look under the microscope, I see the best moving sperm, catch it, and inject it. That's not enough. Because if you get another embryologist, might choose a different sperm. So it's not objective, it's very subjective.
Yeah.
Now, there is many ways to choose the sperm other than the eye. One of them is the Zymote kit. I like Zymote because you put the sperm, the best ones, mix it till the end, pick it up. Pixie, you put sperm in a certain specific dish. At the bottom of the dish, it has a protein similar to the egg protein. And the sperm that goes to the bottom and sticks, you catch it. Because that's more likely to go to the egg, right?
Yeah.
So the stickiest, you pick it and then you inject it.
Into the egg.
That's the Pixie. So you have Zymote, you have Pixie, and you have the eye.
Okay.
Which one is best?
And what's ICSI?
ICSI is when you take some sperm and inject under the microscope inside the egg. You can have, let's say I have 5 eggs of yours. I'm babysitting them.
Yeah.
I can either pour your husband's sperm and come the next day to see how many of them fertilized. That's not ICSI.
Yeah.
Or I go pick the sperm, the best one under microscope, and inject each egg. That's called ICSI. Right? That's called ICSI. Now, choosing the sperm with that dish that I told you about that sticks, it's called Pixie. Choosing with the Zymote.
So why do more people not do ICSI then?
Because it can be invasive for the egg. If you see ICSI on YouTube, it's scary. You have a needle going inside your egg this big and poking it and coming out. Yes. I'm not scaring anybody, but I'm just trying to tell you is I think we do more. There are clinics, they do 100% ICSI. Now, if you're going to do genetic testing on your embryos, most clinics, they do ICSI. Because let's say your husband give me sperm and you say, Dr. Merhi, I don't want to do ICSI. Fair? I have 5 of your eggs. I got your husband's sperm and I pour them in the dish, right? Now I made embryos. Now I want to do biopsy. But guess what? The other dead sperm is still around. It's going to contaminate your genetic testing results.
Mm-hmm. Okay.
But if I know the egg sperm and I put it, there is no other sperm that's dead around that's going to contaminate your genetic testing of the embryo.
Right.
So you're right. ICSI is good, but if you do it too much, might not be good. I do a lot of conventional IVF where I don't do ICSI.
Okay.
Because if you have bad embryologists, they can ruin the egg.
Absolutely. Yeah. Do you recommend PGTA testing for everybody?
No. 50% of patients, when you have sex at home, you're not testing embryos inside your body.
Right, exactly.
Because if you do, let me know. We can become the Tesla of IVF and we can have an Elon Musk investor. You don't test. Most embryos, when you have sex at home, the abnormal ones don't stick or end up in a very chemical pregnancy or early miscarriage. Survival of the fittest. The good ones tend to stick. That's why there is more normal people than Down syndrome and other things. Now, it depends on the patient. If you are 47 years old and you're doing IVF, to do genetic test PGT on your embryos, you need this embryo to develop for 5 up to 7 days in the incubator. Your eggs and your embryo might not survive those days. It might die just because it doesn't like the incubator. It's too much stress. So you don't want to stress sometimes embryos.
Right.
Now, if you come to me and say, Dr. Merhi, I get pregnant, but I'm miscarrying, and when we test the tissue, it's chromosomally abnormal, I'm doing PGTA. I don't want to have another miscarriage.
Right.
So I individualize. Now, some people say,
because sometimes they're like, over 40, everyone should get PGTA testing.
But you're not using condoms at home, right? So you can still get pregnant with an abnormal baby.
Yeah.
Right. So, again, there is no right and wrong. I always have plan A, plan B. I think 50% of my patients, I tell them to do PGTA. Some 50% I don't. Look, when IVF started, first of all, it was natural cycle 48 years ago.
Yeah.
Patient took no medication, 0. And the patient had fresh day 3 embryo transfer. Not even 5 or 7 days, and didn't do PGTA. We do a lot of things now, but I can tell you with technology and the more you know, sometimes it's not as good. Because there are embryos that are mosaic. Half normal, half abnormal. What are we going to do with those? Guess what? They can correct themselves, a lot of them, and give healthy baby.
Yeah.
So the question is, are we throwing embryos that could have given healthy babies? And some experts say yes.
Yeah, Dr. Amy said that to me when I interviewed her. She said to me the same thing, kind of what you're saying, is that sometimes people throw away healthy embryos that can meet healthy babies, and you're messing up someone's chances, especially if they're older. of what their outcomes could be. So she looks at things from a really different lens versus.
That's why I love Dr. Amy.
Yeah. Yeah.
But look, Iman, when you do genetic testing on the embryo, you're testing the outside, not the inside. You don't want to hurt the embryo, the baby inside. Yeah. But the outside, it becomes the placenta. Yeah. And guess what? 20% is not the same as the inside.
Yeah.
So if I have abnormal result, but the inside is normal, and vice versa, it could be normal outside, but the inside. And that's why people miscarry with genetically normal embryo. And if you test some of them, they'll become abnormal just because you're not. It's not reflective 100% of the baby.
You know, the whole beauty of fertility is that I love is there's so much yet that we still don't know. It's science, and that's okay because God essentially creates that, right?
I agree.
Allah, God, whatever you call him, whatever he is to you. And it's like these stories you hear of people who do so many rounds of IVF and then they get pregnant naturally. People still haven't figured that out, but that is source, that is creation, and there's still a mystery to that. And I think the mystery still needs to be celebrated a little bit. I don't know if we want answers to every single thing. We want to increase our chances. We want to be able to conceive later. We want to be able to have children with our own eggs, have healthy embryos. But I don't know if we want to play God in the sense of micromanaging everything and removing the concept of creation and bringing life into this world. I don't think we should over tamper with things.
I agree with you, 100%. And that's what I do believe less is better. I do believe the body can sometimes heal itself. That's why our body have stem cells. I can cure you with your own body. So I agree with you. I think, God created us and there's a lot of things we don't know. And maybe God doesn't want us to interfere with this.
Yeah, things. I think like people who just before I interviewed Dr. Brian and me and him were talking about how it's for me it's about the healthiest embryo, girl, boy. At the end of the day, I just want the healthiest embryo, right? I don't want to be like, well, the weaker embryo is the girl, but I'm going to still take it. I want what's destined for me, whoever is the strongest embryo, right? Because I don't want to tamper with that. 1, 2. People have taken this so far that they literally want to take their own genetic materials, not like they're getting an egg donor, and choose eye color, this or that.
That's a lot. That's a lot.
We're taking things so far, and I think that we need to go back a little bit to source, to creation, and allow the creator who created us to come through and work his magic.
I agree with you 100%. I really do. I'm
so excited to be coming out to the Bahamas. We're going to also have dinner and hang out.
We're going to celebrate. Whatever happens in the Bahamas.
Stays in the Bahamas.
100%.
No, but I am so excited. And guys, everybody listening to this, Dr. Mary, when I found out about you through Dr. Amy, it was such a light of hope. I was like, wow, there's a person who's doing all this amazing stuff. And she told me about you when I interviewed her. She's like, there's this incredible clinic in the Bahamas. They're doing all of this stuff. And I was just like, really? Like in a way, the science has come so far to give me a better chance of being able to use my eggs. Because when I was originally going to go to Greece, they just said to me, they're like, just get an egg donor. I was like, I don't want to get an egg donor off the bat. I at least want to try. To see. And then if it doesn't work, fine. I'm totally open to egg donation, but I just don't want to be written off like that.
You're so young for egg donation. No, we're not going to talk about this
it's crazy. When I called the embryologist, and they're amazing, they're lovely doctors. It wasn't Dr. Pantos. It was Institute of Life, and they're lovely. They just said, they're like, you're 41, you're going to be 42, you're going into your 43rd year, just go with egg donation. And I said, haram, I don't want to just go with egg donation.
I think everyone should try with their own eggs.
That's where my husband's at.
Because if I was a patient, I want a doctor to give me a chance, even if I'm 50. At least I say I tried. If it doesn't work, and at least I say, okay, now I tried my own. I'm going to donor egg. I'm not against donor eggs, Iman.
Not at all.
Listen. It's not only about genetics. There's something called epigenetics.
Correct.
If I take an egg from someone who has diabetes and hypertension and cholesterol and put it inside your body, and your body is going to turn off those genes because you don't have this in your family history, and that baby is going to look a lot of behavior and a lot of like you.
Yeah.
Epigenetics is the environment that turns the genes. And this is more important in a lot of studies than genetics. Genetics is just a material.
Yeah.
But you can code it back and forth.
No, I'm just so excited. went on this personal question. I became very vocal about my journey because I wanted to help educate people, show more women about their options, talk very openly, bring on people like yourself, and just listen. Infertility has become a very big part of a lot of people's life. I don't want people to be ashamed. I don't want them to be scared. I want to empower couples and women going through this journey by sharing my experience, whatever the outcome may be. At the end of the day, I'm going to be a mother. I absolutely love children. It does not matter how these kids come in, as long as I get to be able to raise and love a child.
I agree.
And it's at the end of the day, a lot of it's also to do with the guy upstairs and,
true.
how he wants it to happen.
But, I want to mention this, Iman, because really we need to increase awareness for women, and when they are in school and middle school and high school. We teach them about safe sex and condoms, right, in school,
what about
the
fertility?
Girls. But we don't tell them reproductive aging. We don't tell them about menopause. We don't tell them that the egg quality declines. We don't tell them about AMH. I think we should, that part of school education for every girl in school. And I think every pediatrician at the last visit should checkbox about discussing this, because a lot of people with the frozen eggs and not be in a situation where right now
I would have if I had known about, because I look really young, I'm super active, whatever. People are like, oh, you're going to be fine. I would have maybe at 33, 34 frozen my eggs had I known.
You should be informed. And I think it is
choice.
I think it's malpractice, to be honest with you, for any gynecologist or primary care doctor, not to mention it. In my opinion, I could be harsh, but I get emotional when I talk about it. But also, look, I tell patients freeze eggs at any age. And people think I'm crazy because mitochondrial replacement therapy, when IVF started, people thought it was crazy, right? Yeah. When egg freezing, now mitochondrial replacement therapy, any egg from 60-year-old with mitochondrial, you can get that patient pregnant. And if she doesn't get pregnant, she can use surrogate. There's surrogacy. Yeah. But people are going to regret discarding eggs.
Absolutely.
Even at older age soon. So I tell people freeze eggs, especially the immature ones, for future MRT. Absolutely. Please do not discard them.
Do it and keep it.
Even if you don't use it, throw it out. But the world, the science is evolving.
Correct. And this is a very, very, very new space. We have so much to learn and so much, exciting stuff to come out. So thank you so much for coming on Biohack-it. And I'm excited about Bahamas. 2 weeks. Look at that.
I love your show. I follow you. I listen to all the things that you see. I'm very, very happy and proud of this program. I really am.
Thank you.
And thank you for having me.
I'm so honored we got introduced and you and I hit it off right away. So.
Right away.
Thank you.